Greetings, I'm Jim Kahn, and today we are going to look at how to complete the budget template for the GBHI session on budgets. First, some introductions.
Hi, I'm Cathy from Colombia. I'm a musician.
Hello, I'm Emmanuel Epenge, a neurologist from Democratic Republic of Congo, a seventh cohort of GBHI.
And I co-lead the economics component of GBHI. And we're going to start by looking at an example of a completed budget. So now I'm going to share my screen. Here we are. We are looking at a completed example of the budget. And as you can see, this particular example is about a care program, provide facility-based daycare, group activities, therapies, a meal for individuals with moderate to severe dementia. Hypothetically, this program is in Brazil, and it's for the year 2022, and we are portraying 1 month. It's important to specify that. As you can see, in these orange cells, we are putting in two basic, very important things: the number of inputs used for each type of input and the price. So if we scroll up to personnel, that's usually the biggest category. We start with physician, and the input unit that we're using is days. So in a month, how many days of physician time? The estimate for this program is there's 10 days of physician time at a price of $150 a day. This number here is then automatically calculated simply as the product. So 10 times 150 is 1,500. There's also a clinical officer who works 20 days per month at $100 a day. That's 2,000, and so on. This particular list happens to line up perfectly with what's needed for the program, but you can change who the personnel are. You can add new rows by inserting rows. And therefore it will, and you put in the same numbers in columns D and E, and you'll come up with the same total in column F. You do that as well for supplies and equipment and services. And then at the bottom, and space, training, at the bottom is a total. The total is $16,547. That's for 1 month, as specified here, and that's actually grabbed from the label that's put in up here in row 6. The total for the year, simply times 12, is indicated here. Now, we allow for multiple sites, so maybe there are 3 sites that all look similar, and so multiplying by 3 gives this amount. As you will see in the budget templates, the goal is to spend a total across all programming of $2 million per year. So you can see this particular program with 3 sites comes out to about 600,000. So you could make that more. They could put 5 in there and make it 5 sites, and then the total would go up. Finally, at the bottom, we have the number of services provided, and this can be altered, but the specific output in this example is that 1 client receives a day of outpatient care. For example, 30 clients seen for 20 days during a month comes to a total of 600 client days of service. If you then divide the total by the year amount here, you can see that it costs about $28 to provide 1 person a day of service. So that's how it works. Now, we turn this back to Cathy and Emmanuel to do a different example.
Jim, can I ask you something before we go forward? So this last part you show is gonna also change depending, like automatically depending of what we decide to use. Like 1 client receive a day, but if we have, I don't know, 15 clients and 10 days. So
And you change this number to 150.
And
this
it's going
number
to change
600
automatically.
So if I put 150 in, instead of 600,
Mhm.
then that changes.
Oh, perfect.
Yeah.
Okay, thank you. So now, I propose, Emmanuel, what do you think about a program for care, but including some arts into the care program?
Yes, like we can have a cross disciplinary program on dementia, a cross disciplinary program.
Good. And would you like, I'm not aware of how much it cost the health services in Colombia. So I know about art, but probably we can use Kinshasa.
Yes,
For
we can do
example,
it.
because
Yeah,
as you know, the prices of the services.
yes,
So for the time period, what do you think, Emmanuel?
yes, we can put it for 1 year.
And this is different, right? So we are gonna plan for 1 year, but the
Yeah,
time unit is just for costing. So we could say it's a month.
The intention for the time period is, to specify the actual year. So you could say 2022 or 2023,
okay,
like that. Yeah.
So let's say it's gonna be for next year, 2024.
yeah,
Mhm.
you can
And
edit.
so I have a question, Jim. If I have like a program that is gonna be long term, like we are saying 5 years program, so we will say time period will be 25, 30, and the time unit is still monthly or is gonna be year?
Yeah, the time unit is selected for your convenience. If you think about what's needed for the program in terms of months, then you put month. If you prefer to think in terms of an annual budget, then you put year. Those are both reasonable choices, and it kind of depends on um, just how you're thinking about program operations.
We can do it for 1 year, 2024.
Yeah, but then the unit cost will be month, as we only have 1 year, so it's
Yeah,
probably. So how much do you think is physician cost, Emmanuel, in Kinshasa?
a physician cost, it can work from Monday to Friday, so it will be for 5 days. It can be $20 per day.
So what do you think we should write here? Would you help me,
So,
please?
we
So
can
let,
put,
let me just jump in. You don't need to alter that. If you like measuring physician time in days, you can leave that one alone. But you go to the next column. Oops. So go back and just undo that, Command Z. Leave days there. Good. Now, how many, what, it seems like we're thinking about a month. How many days will a physician work per month?
okay. Per month, it will be 20 days.
And the cost is $20.
Yes.
So will be also 20 here. Is it right?
Yes, I think it is. But when you put $20 for 20 days, it's not uh, less money because the physician is working 20 days per month and he receives $20.
No, he will receive 400
400. Okay.
months, right?
Okay. Is it not too less? Or maybe you should get too much, $30 or 40?
So do you think if we pay $40 a day, it's still a good amount in Kinshasa? It's gonna be affordable.
Yes. If it is a specialist, $40, it's okay. But if it is a GP, a general practitioner, $20, it's okay.
Good. So let's
Yeah.
say this one is a physician is gonna be the right word, or specialist?
If we want to work with a neurologist, I think we can put $40.
Good. So
Okay.
this will be the amount. And
Yeah.
let's say now that we are gonna have a GP, right?
Yeah.
And then they will also work 20 days
Yes.
and we will pay $20.
$20. Yes.
Okay. Good. We could have a music therapist.
Yes.
And let's say they work 3 days a week,
Yes.
like 12 days,
Mm-hmm.
and we can pay again like the GP.
Okay.
Yeah.
Is it good for them or it is less money for the music?
I think in Colombia is really less. We should pay more if we are in Colombia, but
Yes.
it depends also of if we think in Kinshasa, how much do you think is a
Yes,
good?
I think in my country, $20, it's okay.
Okay, so let's keep it like that. If we
Yeah.
change the program for Colombia, we would probably pay more for the music therapist.
Okay.
What about the nurses?
The nurse also can be there for 20 days. They can receive $10.
And do you think $200 is good amount for paying nurses in your city?
Yeah.
Okay. So, Emmanuel, are you okay
Yeah.
if we stop here now and we go to the end of the sheet so we can
Yes.
view?
But here it's small. Don't forget that we have $2 million. So I think we should suggest some other sites that will help us to have more impact. Why not 10 sites?
Perfect. So we can work with more people.
Yes, but if we put like 10 sites, it will be like 100,000 for per site. It works like that.
Yeah, but we haven't worked in the whole budget, so this is gonna raise the
That was
numbers.
what I was going to mention also, that there are plenty of blanks here for demonstration purposes. You haven't yet completed all those, so this will change as you eventually fill that all in.
Okay.
Yeah. So we are gonna work in 10 sites. And later on the amount is gonna raise. But what about this? So we have to find the number of services. It's okay if I go to the example because I don't remember exactly how it was it. Like one client receives a day of outpatient care.
I
So
think the number of services it will gather all the service, the medical services and the non-medical services. It will be separate. like when we want to do the musical therapy and all medical stuff, we can put it all together.
Yes.
If we
I
put
think
it
that
all,
makes sense.
Mhm.
I think to combine in some combined measure of number of services provided.
Yeah, I think
I
it can work for 20 days.
wait, I have a question. So if I have 1 day of care for one client and I say 30 clients, it means like it's 30 clients a day? Like we are like physicians and neurologists and musicians are attending 30 persons a day? That's what it means?
Exactly. So the idea is that you've got the staff and they have the ability to provide services. How many people use the services? Or if someone comes in for all or most of the day, that's one person day of care. If
Okay.
15 people come in, that's 15. Then the next day, another 12 people come in, and the next day it's 20 people. You add them up and you get a total for the month of person days of care. Now, of course, there are many different ways to measure number of services, and this is just one way to go about it, and it's crude, but at least gives you a sense for how much you're paying to provide the service that you want to provide.
Good.
Okay.
So how many people do you think we can attend each day, Emmanuel?
But I think for me, for 20 days, I can receive 5 patients per day. So for a month, it can be 100 patients.
Okay, let's say we receive 100 persons and will be 20 days, right?
Yeah, for 20 days. Do we have to put also the days? Okay, okay.
So here we should write 200.
I'm sorry,
200.
what number did you say?
200 or 2000?
So are you saying 100 people come in each day and they're 20 days?
Yes.
If that's the case, then that's a big program. That's fine. And then you would put 2,000. So 100
2000.
times 20 is 2,000.
Yeah.
And then
That's
you
not
have a
realistic.
very efficient program. I think maybe you're being optimistic about your capacity, but remember this is just for one site.
Right.
It's not
Yeah.
for all of the sites.
Okay.
So
Exactly.
maybe it's less per site.
And we haven't complete the other amounts like rent and the other things that's gonna be very expensive. So
Right. A good point. There's still some work to be done here of filling in those costs. So that number $1 will go up. Let me just make a final comment, if I may, about the budget you're working in. As we explained in the assignment, the goal is to spend $2 million per year across 2 different programs, or even 3. Right now, because you haven't fully completed it, you don't know what this program is going to cost, but maybe it, might come out at $800,000. If that's the case, then you have 1.2 million to spend in some other program, and you can then increase the number of sites to reach that target of 2 million. So this total in cell F40 will be the same in all of the sheets, so that you can always keep track of the total, which again you want to target to 2 million.
perfect.
Yeah.
Thank you, Jim. That was really helpful.